Hi there, my name is Annette Bray. I help individuals work through the pain in their physical body and the emotional patterns in tandem so they can transform this into wisdom on the other side. A sense of freedom in the body and the mind, a comfort in their own skin, and the most authentic sense of an empowered self. And today I want to talk to you and demonstrate for you what I would call the movement of the heart. And the heart is so much more than an organ that pumps your blood. And while that's a huge function, there's a lot more to it. And we're challenged to move the heart when we are restricted in areas of the body that impact whether or not the heart has freedom to move. So it could be the chest, the kidney space, or where the low back meets the middle back. That's where the posterior diaphragm comes in. And the rib cage and the spine, and all these structures contribute to a heart that doesn't move. And so when they're battened down, we limit the ability to move the heart. And when we can't move the heart, there's a whole host of things that we're missing out on. We're missing out on positive emotion that we can be more expressive of in our lives for our environment, for the people around us. And so that lack of movement in the heart actually has a greater impact than just the biomechanics. The heart has been discovered to effectively have its own brain. And I think that's in the past 30 or so years that a nerve bundle was discovered in the heart that actually is more directive to the brain than the brain is actually directive to the heart. So there's an innate wisdom in the heart that we're really just starting to tap into. And when we are restricted and tight and we don't actually move the heart, we do actually have less access to these emotions that actually allow us to be more intuitive, more connected to our own innate sense of wisdom, and our ability to actually open up and be more in genuine relationship with others. So I'm just going to demonstrate a part of the movement in that thoracic spine that people really struggle with, and encourage you to practice this and see how it is for you. And then partly as a baseline, but then become an exercise of practice to understand what's happening when I try to move my heart, as I'll instruct in a moment. What do I feel? What's my experience? And how can I start moving it more? And then what happens when I start moving it more? And so what I'm going to do is encourage you to sit and in a chair, preferably, so that you can have an upright spine and your low back's going to be in neutral. And what we're going to do is try to actually get the movement of that thoracic spine separate from the lumbar. So we don't want the lumbar to be moving, and we don't actually want the neck to be moving. We want just that thoracic spine to move, so that right above that low back, we start to round, and we let the shoulders kind of curl, but not shrug. That's really different. There's a broadening through the shoulder blades that rounds the back. And then come back and lift and open the chest without pushing the lumbar forward, because that's just compensation. That's just forcing the opening. And what I'm trying to get you to do is focus on the distinct movement of that thoracic spine and taking a moment to notice what's happening with your sensation, what's happening with your emotional disposition when you are trying to move this. What's the challenge? Or maybe what's the openness? And use this practice to move more and to discover why is there holding, and how can I actually change the movement of the heart to start to experience a different kind of emotion on the other side. And on September 3rd, I'm going to be running a workshop, and it's online, and it's entitled The Movement of the Heart. And I'd love for you to join. I will include a link in the notes below this video, so that maybe you can explore this with me if this calls to you, if there's an understanding innately from you that maybe there's a holding that you could work through that would benefit you. So I invite you to join me, and I invite you to ask questions and engage with me in a way that'll allow me to reach out and support you. So I thank you so much, and I hope to see you again. Bye-bye.